Hi there. Today I want to talk to you about expansion versus retraction orthodontics. It's a topic that comes up when parents are asking me whether or not their children should have teeth pulled in order to have better orthodontic results. And my answer to that is not if we can avoid that, which we should be able to avoid it using more modern techniques. So historically, the jaws, sometimes when jaws weren't growing as they should, something like headgear would be used to pull back on the jaw and actually slow the growth of the jaw that was set further forward. And then still happening today, the photo on the right shows how teeth with the X's would be removed or can be removed, and then the other teeth are kind of retracted back or pulled back into their place, so that what we end up with is, instead of expanding jaws to make sure that we can fit all of the teeth we naturally have, things were pulled back. And we ended up with jaws that were too small, teeth that were straight, but jaws that were too small. And that can have other health consequences. And that's important to look at from the front to back of the jaws, kind of in this view, but also side to side, kind of right to left. So this photo kind of shows you a little more what I mean by the side to side, right to left. So historically, our ancestors had nice, broad jaws that fit all of the teeth, and then more recently we had just more crowding, and that can have effects on our airway space and how we're breathing. So in this photo you can see a side-by-side comparison of these are 3D CBCT x-rays taken of patients, and on the left side, that's kind of the analogy is someone's trying to breathe through like coffee stirrer, instead of on the right side where they have a nice garden hose that they can breathe through. What's happening in this image is the person on the left, their jaw, you can kind of see here the way that their jaw is kind of folding back, kind of tucked backwards compared to the rest of their face. And what happens is that relationship, then their tongue kind of pushes back into their airway space, and they end up with less space to breathe through. So that's why we want to focus on kind of expanding everything, expanding kind of front to back and expanding side to side, so that it's not just about the teeth, you're actually kind of growing the shape of the face to allow for better breathing. So that is super important for our better breathing is better sleep, better breathing is better overall health, and all of that is obviously critical. So this shows kind of what I'm talking about when, again, we're talking about what's happening now is we see patients come in with these small V-shaped crowded arches, and what we want are these nice broad U-shaped arches. So there's a variety of methods to get us there, but that's what we're going for. And then this is, again, to kind of show you and really take home that message. Here you have kids that were both treated orthodontically and treated with kind of posture and habit improvement techniques. So that's myofunctional therapy is the term we use for that. So you can see here before and afters, these kids had dramatic improvements to their growth, expansion forward of lower jaws, which then resulted in just healthier looking kids, and their muscle tension goes away, their faces are relaxed, they're living better lives. And you can see that in kind of that front to back view when you look in the side view of these kids on the left, or when you're looking straight on, you see kind of the side to side expansion that can take place. So our baby teeth are supposed to have space between them because the adult teeth that are coming into their place are wider and they're going to take up more space. So in this case, this little girl had expansion that allowed for space to be created between her teeth. And as a result, instead of kind of straining her chin up, that was likely a compensation for her to try and breathe better, she's now also more relaxed and going to have a brighter future. So when asked about getting teeth pulled or kind of retractive orthodontic techniques, I am always going to be a proponent of choosing expansion techniques instead. Thanks for listening.